My name is Dr. Robert J. Woodbine. I'm a licensed naturopathic doctor in the state of Connecticut, and I'm also licensed in the state of New York as an acupuncturist and practitioner of Chinese medicine. Well, I don't believe that I can heal anyone. To me, that's a level of arrogance. What I attempt to do is to allow people to access their own healing capacity, because I think that's inherent in each individual, that's God-given. So all of the tools that I use is with that in mind, and with creating a level of self-sufficiency so that individuals can depend on themselves and not depend on me. I use things like Qigong, for example, or therapeutic breathing, so that patients can learn to access their own healing capacity. The spectrum actually crosses both Chinese and naturopathic medicine relative to lifestyle counseling, nutritional, dietary recommendations, physical movement or exercise, therapeutic nutrition, and then there's the Qigong and energetic exercises and practices. The role of a naturopathic doctor is to empower their patients to be as knowledgeable as possible with regards to their own health and their own healing. What I do oftentimes is create the type of relationship where they are learning as much as possible about their health concerns, health conditions, and feel that they pretty much can take care of themselves. I often tell my patients that the sooner that I end my relationship with them, the better I feel that I've done my job. So that's one of the foundational principles. Another one in naturopathic medicine is finding the root cause and treating that. Pharmaceutical medications don't actually get to the root. They mostly deal with the symptoms. And it's important to sometimes deal with the symptoms, but if you don't get to the root, then you're just perpetuating a cycle that continues on its own. So there are times when it's important to use them, and there are times when you have to have an avenue for weaning someone away from that in cooperation with their medical doctor to do that. But the patient is the one that has to drive that. One of the things that patients complain the most about is the lack of, call it face time, with their physicians. Most physicians will spend maybe 6 or 12 minutes with the patient. My initial visit takes about an hour and a half with a patient. So, and even that's not enough time, it seems, in some situations, so I'll go over a little bit, but it's enough time to give the patient an opportunity to tell their story or their stories. And if one listens clearly enough, you tend to hear exactly what is the root or roots of the patient's complaints. They may not have the language for it in terms of technical language, but if you listen well enough, you'll hear it or you'll feel it. Western medicine is pretty much caught up in the Cartesian model of the body being seen as a machine with a compilation of parts that either work or don't work. And when they're not working, then typically you'll resort to either surgery or pharmaceutical medication. Well, Chinese medicine looks at the body as a flow of energy, that when that flow is working well, then the body is healthy. When that flow is not working well, then you have symptoms that give you indications that something is amiss, and therefore you can try to figure out what that is and bring the body back to balance. You have terms like meridians, which are energy pathways, qi, which is intrinsic life force, and therefore you have different modalities that access that qi or that intrinsic life force in order to help the body to rebalance itself. One needs to live in harmony with nature and the universe and with others. The emotions play a major role relative to whether or not those energies are balanced, and can in fact lead to physical and physiological manifestations of illness if they're not balanced. Our assessment in Chinese medicine has to do with subtle energies and observations. For example, we'll feel the pulses, and people get confused with that and kind of very curious with that, but the same radial artery that we use in Western medicine to get a sense of the rate of the heart, in Chinese medicine we can divide that same radial artery into various locations that represent internal organs. And depending on how they feel, which is why it takes about 3 years of a master's degree program, you can assess and determine what's going on energetically and then come up with a treatment plan. Generally speaking, especially in European and Western culture, accept the disconnect between the body, the mind, and the emotions and the spirit. That goes back to the Cartesian model, where the church was given purview over the spirit and the soul, and medicine was given purview over the body, so to speak. We are not separate in that way. We exist on many different levels. It's a matter of becoming aware of that. The fact is that our emotional lives are connected to every other aspect of our lives, and they interplay and they have an effect. We can look at someone who's sad, and you can see the body language, and you can tell that something is amiss. They may not have a clinical manifestation at that moment, but if it persists, someone going through a grieving process, it can then result in depression. Right? From a Chinese medicine perspective, the emotion of sadness, of grief, of depression, when it's prolonged, when it's chronic, can injure, for example, the lungs in Chinese medicine. The lungs in Chinese medicine are described as providing what's called Wei-Qi, W-E-I, Qi, or that intrinsic life force. It's a type of energy. And the Chinese say that what it does is it provides this protective barrier just on the outside surface of the skin. And they say that it protects us from all pernicious evil influences. Well, it's your immune system. That's how we interpret it from a Western perspective. When grief is prolonged, then the Wei-Qi is diminished. And we know in Western medicine, for example, that those individuals that have prolonged grief or in a depressive state, the immune system is depressed. So there's a direct correlation there. In Chinese medicine, there isn't always a direct translation to Western, but that's one that one can look at. From the Western side of the house, you have individuals like Candace Pert, who wrote a book, The Molecules of Emotions, where she was able to map out the chemicals in the body that are related to different emotional states and how that affects the physiology. So Western medicine is catching up to the ancient sciences, where there is no disconnect between the body and the mind and the emotions and the spirit, and they all interplay. This disconnect between the body and the mind, the emotion and the spirit is so pervasive that patients won't speak up for themselves. They don't feel empowered in front of a physician. And it has nothing to do with how much knowledge that person may have. We all put on our pants the same way or dresses and do whatever we do. But there's this mystique of the medical profession that we buy into, and the culture promotes that somehow they know something. They have information, but human beings are human beings, and when you can relate at that level, the healing is already activated at that level. It doesn't matter what modality I'm going to use. I could do anything. I could do nothing, and you're already on your way. I have patients who are afraid because I'll tell them you need to go see your doctor. And you need to, when's the last time you had a complete medical workup? So it's been 5 years. 5 years. You need to go see your doctor and get a baseline of where you are now. I can help interpret that from my perspective, but you need to go. They're afraid to go. And they're afraid to go. One main reason they're afraid to go is because they think something's going to be prescribed that they have to then do or take. And I said, no, you don't have to. Just get your assessment, your diagnosis from that perspective. Use the tools, use the technology, but feel empowered. You don't have to do anything even that I tell you. You've come to me because you think I'm whatever. You don't have to do anything I suggest. And by the same token, you don't have to do anything they suggest, but take advantage of the technology and the tools and the assessments that they have to give you. There are great doctors that are out there, My pediatrician, going way back, was right here on 139th Street, right around the corner, and he was great, Dr. Patrick. Um, Excellent bedside manners. We don't even talk about bedside manners anymore. But he engendered a sense of feeling safe and feeling heard. Um, and oftentimes it was just in a touch. He would touch you. And a lot of doctors don't do that unless it's for a medical purpose. So there's that fine line. And I think if you're well trained and you have your ethics well rooted, you can extend a human touch, because sometimes that's what a patient requires at that moment. But a lot of doctors will keep that separation, and they're not dealing with a human being, and that's what that human being requires. Oftentimes people will complain of doctors just treating the lab report and not treating the person. There's a long history of injury to people of color in this country and around the world. There's a lack of access, there's a lack of affordability, and more importantly than that, there's a lack of really focusing on empowering individuals to be self-sufficient, such that they can control their own health. And so it goes beyond providing the appropriate nutrition or those kind of recommendations. It's about how we live as individuals in this kind of community. The injuries go to the heart of spirit and emotions. There's a tremendous amount of anger and frustration that has, on the face of it, nothing to do with how one eats or whether or not one exercises. But to be respected as a human being, as a man, as a woman, as a child, there's a tremendous amount of pressure that individuals experience on a daily basis that is extremely stressful. That's a major contributor to the chronic illnesses that we see. And that's an area that I'm very interested in changing. Cardiovascular disease, diabetes, all of those are interrelated. And stress plays a major role. It goes beyond health being defined just as things to do with your body. You start dealing with politics and economics. So it's this whole broad spectrum, and hopefully I can play or am playing some role to create the kind of shift, even if it's one individual. But my interest is in breaking the generational trauma that persists from one generation to the other, from the original injuries that we experienced as a group of people. And hopefully there are others that are thinking that same way, because these injuries happen all over the world. And so then the discussion becomes a much larger one, because it's not about white and black, although that's the conversation that most of us fall into, and it's a very narrow conversation. It's really more about good and evil, and you find that all over the world. And if you broaden the perspective to that, then ripples come out of that are more appropriate to focus on, right? Beyond just, are you taking your vitamin C and are you getting enough exercise? So that's what I try to do. Yeah. Breathe in and breathe out. And now also including in your field of awareness the sounds that you hear. Outside, the trucks and cars passing by, the tick and tock of the clock on the wall, the various motors in the building, your heartbeat or the stream of your breath through your nostrils. Sound therapy is just one of the variety of modalities that I use in my practice. The crystal bowls, I was introduced to those in Nice, France, and that's where I learned to use tuning forks, German-made tuning forks, using the acupuncture points and meridians to access the therapeutic value of using sound that way, especially for individuals who are needle sensitive or needle shy and don't want to be needled. I also use my voice, and that's ancient, using the voice for chanting. I also teach my patients actually how to create a sound map using their own voice. So what we would do is use the vowel sounds and repeat a vowel several times so that the patient can then get a sense of where that resides in their body, and then map those sounds throughout the body. And if, for example, the vowel A is felt mostly around the abdominal area, if someone has an upset stomach, they can use that same sound to help resonate that area and create a sense of balance and feeling better.